So we are going to talk about women health and more towards perimenopausal and menopausal age group. So as a gynecologist, they come, when they see a lady doctor, that's
the menopausal women who comes to us because of dryness, vaginal dryness and hot flash. On a diet, avoiding food, they increase the coffee and tea intake.
I think nobody spoke about it, right?
It was
biggest monster, the weight gain. So what do you think weight gain, how to combat weight gain?
You can definitely prevent gaining weight by doing certain things.
And what about this protein intake? They say meal replacement therapies and then increase your protein.
Controversial talk, Hema, because maintain your weight. It is definitely not easy to reduce weight.
When we talk about calcium, can you talk about something which is in your regular diet or something? Don't skip this so that at least the calcium is maintained to a certain level. And of course, what is the role of HRT? Everybody talks about it, jokes about it and all.
Don't forget anything. They come and complain that they're not able to remember anything. They feel fatigued all the time.
Earlier there was a lot of debate about this, right? That breast cancer can be caused because of the HRTs. Sometimes, they say I fainted.
Hemoglobin will be 3 to 4.
And okay. And this HPV. Now, why is it so important that the awareness of human papillomavirus vaccination is so? So, during menopause, what are the skin symptoms which, the concept, right? They come with all their problems and then they complain about the skin also. So, what are the problems? Hello, I'm Dr. Hema Satish and I have here Dr. Jayachitra, who's a very well-renowned gynecologist.
Hello, Dr. Hema.
So, we are going to talk about women health and more towards perimenopausal and menopausal age group. So, Dr. Jayachitra, my first question would be, what kind of women come to you and what do they complain during menopause?
First of all, the menopausal women who comes to us because of dryness, vaginal dryness and hot flashes is more and more in the past few years, because the awareness about all these symptoms, we are seeing it more often, and most of the times it is because of hot flashes, night sweats, irritability, mood swings. These are the very common things perimenopausal to menopausal age women experience.
Do they think that this is absolutely normal or they come to you seeking help?
Previously they were thinking that it is completely normal, and all the women, they undergo this process. But nowadays, because of the social media and because of awareness programs, we are running a menopausal society in Madurai. So we go to various colleges, schools and conduct many awareness programs, and we see many girls and women, they are aware of all these problems and they come to us asking for help. And that because the quality of life gets very much disturbed for them, because we see many working women nowadays. So these women, they experience night sweats, and because of that they are not able to sleep, and they have the quality of life gets disturbed, their work gets disturbed, and because of that they are stressed out. So when they come to us, we have many options for them, and definitely I will say the awareness is more nowadays.
Okay. So when you're talking about this hot flashes, I was just thinking that, do you have to really give them as a treatment, or there can be some kind of modifications or modulations in lifestyle which can help them out?
Definitely, because before going into any sort of treatment, we advise them lifestyle changes. Because most of the times we see women wearing heavy dresses, we advise them to wear layered dresses and cotton dresses, advise them to, if they are obese, advise them to go for regular walking, or not only for obesity, even for regular, they have to go for at least 35 to 40 minutes of walking. They have to go for exercises, and we advise them to go for at least 5 days a week, and also they have to go for 45 minutes. A simple walking is more than enough. Once they reduce their weight, they can see drastic changes. And also ask them to take plenty of water, get them hydrated well, and advise them to avoid caffeine and also hot spicy foods.
Like
these things will definitely reduce the incidence of hot flashes, though they might not completely eradicate it, but it will definitely help them.
I mean, have you heard, I saw somewhere in media where somebody was using ice and all on their face. I mean, I do not know, I've never heard of anybody
So
put
probably
it, but
that is a little bit of exaggeration.
Okay.
But the women who experience hot flashes, they will definitely want to do all these things because it is they will be sitting in a cold room, but they'll be sweating out like anything. So what you're saying is probably
off. Anyways, now when you're talking about exercising and everything, so do you think there is a certain form of exercise which they should follow? Like many people say yoga because you should relax yourself and stuff like that, and there is absolutely opposite to that. No, they recommend crossfits or weight training, especially for women who are older. So do you have a take on this?
Everything should be taken in moderation because nowadays lots of women are doing yoga, they do crossfits as you said. But if they are doing all those things, it is okay. But if they are not, if they have been leading a sedentary life, just advise them to go for a moderate paced walking and let them have it from starting from 15, because I recommend my patients to start with just 15 minutes of walking. If you ask them to go for 45 minutes walking, they get exhausted within 15 to 20 minutes. Advise them to go for 15 minutes or even lesser than that. Then gradually they have to build up, and the recommended time of exercise is 45 minutes for at least 5 days a week. So that is more than enough. Once they achieve that goal, then they can go for yoga, they can go for crossfits if they are able to do it. But never ever overdo exercise once you cross the age of 50 if you have not been doing it. Because seeing YouTube and all these channels, we see many women, they start doing yoga and extreme form of exercise, and they come back with lots of sprains, strains, fractures, and that is not good.
So Jayachitra, one more thing I think everybody complains about is vaginal dryness. So do like women, when they come in as patients, they are open about talking about it, or they still shy away from it?
No, actually the women who come to us, they come more with the history of recurrent urinary infection.
Okay.
And the vaginal dryness, most of the time they don't know that because of the vaginal dryness they have infection. But the most common problem is recurrent urinary infection, and most of the time they see the urologist. And nowadays even all the doctors are aware that infection, and specifically urinary infection in a menopausal woman, is most probably due to estrogen deficiency, that is because of menopause. So most of the time when we correct that estrogen deficiency, they will have reduced urinary infection episodes, and also the vaginal dryness also will decrease. Because of vaginal dryness, the incidence of libido as such, because of estrogen deficiency, the libido is also low, and because of dryness they'll have burning sensation, and because of that most of the women, they don't want to undergo any sexual intercourse after menopause. The incidence comes down because of this problem. But when we address this problem, and if the woman is ready to follow certain medications and lifestyle modifications, and with reduced urinary tract infection rate, they get the vaginal dryness incidence also comes down. Okay. And we have to definitely make the spouse understand that the problem is because of menopause, and because of vaginal dryness, the libido is down. And we are seeing patients who wants to increase their libido. Many a times people take some sort of testosterone and those things they were taking, but correcting the estrogen deficiency, most of the time the patient's vaginal dryness goes away, and their sex life is also improved.
So you think, you were talking about urinary tract infection, can you suggest something which they can normally follow, or a general lifestyle modification which would help them avoid such kind of recurrent infections?
See, most of the time the women start taking reduced water intake after certain age, and because of that what happens is they get easily dehydrated, the urinary infection rate is high. So we ask them to take hydration is important, and ask them to, as I said, take reduced coffee or tea intake. And because most of the time when they want to go on a diet, many people, they think that avoiding food, they just increase the coffee and tea intake, and because of that they think they are doing better. But these things can cause increased urinary tract infection, in the sense we have to advise them to take less of coffee, and ask them to, if they have any urinary tract infection, that should be definitely addressed, because most of the time we think that it is just vaginal dryness causing a UTI, but it is not the case. If we have to do a urine culture, just prove that it is not because of infection, and then you can treat the vaginal dryness with some estrogen cream, or even moisturizing cream is enough. Rather than going for HRT, you can just give them some moisturizing cream. That will improve the vaginal dryness.
But the problem is having a vaginal cream is it has to be non-irritant.
Yeah, definitely we have to choose it better.
Because it's a mucus membrane, right?
Yeah.
So we also make our calculations on what to give, what not to give when it is something like that. But then, as you said, spouses also come. So how much do you think the spouses can help, or how much do they help?
See, this is a gradual process, because menopause is not a thing which happens immediately, like it takes 4 to 10 years time. So as the process goes on, the same thing, the recovery will also be little slow only. It is not going to happen the next day itself. So when we advise the spouse, they have to understand what the wife is going through, and if they are understanding, and if the women also wants to get the vaginal dryness treated for the sake of her, to improve her sex life, it will definitely work out. So the understanding should come from both wife and the husband.
And what do you think the families contributes? I mean, if they have children, by the time the woman goes through menopause, I think the children are also old enough to understand quite a lot.
Yeah, definitely.
How much of awareness is there?
Nowadays, even the son, they bring the mother. They also understand that this is something a menopause women is undergoing, and they are more worried about, rather than these things, the children are more worried about the bone and the cardiovascular risk. So because of those things, they want to bring them for master health checkups and calcium supplements for postmenopausal women. The daughters and sons, they ask us whether the mother needs all these things.
That's nice. So that itself must be a lot of support for her.
Yeah, definitely.
Right? That's nice to know.
Because previously you see the women who has all these problems, they never come to the hospital for their sake. They'll bring their daughter for delivery, their son or their husband for any medical illness, but they don't come forward. But nowadays the family also, most of the times we see the family also, they come forward and they ask us to improve their mother's health or
I don't
wife's
remember
health.
when my mother went through menopause. I don't know if you would know. I think nobody spoke about it, right?
Probably, it was like a stigma in those days.
Yeah. So that's nice to know that, now at least people are aware, and I think the awareness should increase much more, so that such problems are not undergone by women. We are also entitled to live a very healthy and nice life, right?
Definitely. Because the 30 to 35 years of our age we are spending in menopause, and that is the phase we are established, we have a good name, and we want to live a peaceful life, and that life should be healthy.
True. God bless. So let's talk about the biggest monster, the weight gain. So what do you think weight gain, how to combat weight gain? I know you eat very less, Jayachitra, but people who like to eat and people who are, then I've heard this all the time, that they'll come and say, I'm going through menopause, so I've put on weight, and then they just accept it. So should we accept it or should we not accept it?
See, definitely it is an excuse that a menopause, I'm having menopause, I gain weight. But you can definitely prevent gaining weight by doing certain things, like take a calorie-based diet and go for regular walking and whatever, swimming, aerobic exercise, cycling, all those things they can do. And nowadays we have everything in our home. There's no need to go out for that. So we have to advise the women, if you want to become obese, you can do it. It is your liberty. But don't blame it on menopause. Because there is a condition where the increase in weight gain brings all the other diseases like diabetes mellitus, hypertension, and all those things, increased lipid profile. So
and
putting the
problems also, right? Joint problems
bone health and everything, and also cognitive disorders, everything comes with menopause. But keeping yourself healthy definitely will prevent putting on weight, because most of the time we see the deposition of fat, it gets distributed to the abdomen. And that is the main reason why the people are more prone to develop metabolic disorders. So to prevent that, walking alone is not enough. They can do some aerobic do aerobic exercise, and also some yogas and flexibility exercise, strength training, weight bearing exercise. All those things in moderation, if they do, they will be able to maintain the weight. Rather, it is not very mandatory to reduce weight, at least to maintain the weight. So weight gain, there are so many clinics and so many places where they can go consult a nutritionist, endocrinologist, gynecologist. There are so many of us who can help the people to understand that menopause is definitely not going to put on weight. If you take some steps to prevent it, you can do it.
That's a good thing to say. And what about this protein intake? They say meal replacement therapies and then increase your protein. So sometimes there are
that's a very controversial talk, Hema, because taking only protein
that also
doesn't help you in any way. You need carbohydrates.
True.
But that doesn't mean that there are so many meal plan. You must be knowing that. So taking very, very reduced carbohydrate and high protein is also not good. As I said, moderation, menopause moderation. For everything, you take it in moderation. Better, instead of taking a proper meal in the dinner time, you can take some fruits and nuts, and all those things can help you to maintain your weight. It is definitely not easy to reduce weight, but it is definitely easy to maintain your weight with all these things.
Yeah, but protein is necessary, right? Because you tend to lose a lot of muscle mass when you're going through menopause.
Only taking protein,
but only protein is not the best.
It is not going to help your muscle mass, because sarcopenia is one thing, that is losing muscles. It is one of the main thing, because we were always talking about bone health. We were never talking about muscle health. So nowadays we are talking more and more, and for that you need weight bearing exercise. So just doing weight bearing exercise doesn't need to go to gym and lifting heavy weights. Just take a half a liter water bottle and just raise your arms up and down, and doing that for 5 to 10 minutes. Just cross your arms with half a liter water bottle. That is more than enough to do it for 5 to 10 minutes. Weekly do it for 2 to 3 days. That is more than enough. So weight bearing exercise, that helps you to prevent sarcopenia. And balancing exercise, just keep your one leg Surya Namaskar and all those things. No, you can just do it for few minutes, balancing and gaining muscle mass and strengthening your bones. That is going to be your for your future, for your healthy future.
And I think antioxidants also, a high level of antioxidants.
Yeah, taking supplements is also very, very essential, because if you think that doing all these things and a menopausal woman doesn't need any replacement, it is not correct, because many a times, because I'm an example, I used to do 1 hour of exercise, and I saw my bone scan. It was in osteopenia range. I was very shocked, because I never used to take any medications. But after that I started taking, and now it is in normal. After taking for 1 year, it is normal nowadays. So because my endocrinologist used to say, even though everything is normal, you have to take certain medications, and for women, calcium is a must.
Yeah, calcium is mandatory. Because we tend to lose the calcium as we grow older, and then the bones weaken, right?
Because from the age of late 20s itself, women start losing calcium. And more than 45 to 50 years, you definitely need replacement.
And that is, I think, quite rapid at that age.
Yeah, very, very rapid.
So when we talk about calcium, can you talk about something like which is like I mean, in your regular diet, or something which you can have it on a regular basis? Like, I mean, don't skip this, so that at least the calcium is maintained to a certain level. And of course, then when they need the pills, or they need the pills, they should be taking it.
Yeah, so, apart from pills, because as I said, pills is must.
Yes.
Take 1 cup of milk, which gives 300 milligram of calcium. Take 1 cup of curd, that also gives you 300 milligram of calcium. And along with that, take all leafy vegetables, broccoli, that is, it is very much rich in calcium. And also you can take nuts, cashew nuts, it's also rich in calcium. So all these things, vegetables and dairy products, if you take it daily, that will at least give you half of what you require. And the other half you take medicine.
Now now the vegan diet is so much in, no? So what will the vegans do if they don't take milk and yogurt?
No, they have to supplement with other, like almond milk.
Okay.
at least they have to do all those things.
So almond milk and all has got that same amount of calcium.
Not
which
that
I don't think
amount
so,
of
right?
calcium, but still they can get it. And
As you recommended, the
they can take
vegetables.
tablets. They can take the tablet along with that. But many vegans, I don't know personally, I don't think they will want to take medications because they're very much like they want to take only these certain fruits and vegetables and dairy products, and I don't think they'll be happy to take any prescribed medications.
Oh, okay. I didn't know vegans do that also. But I have seen that vegans check that when they are taking calcium, they are not taking any bone calcium, because those days and all they used to add. Now there are many vegan calciums, of course, available, but still.
No, some people, vegans also, they check their calcium levels and vitamin B12, because my doctor friends, they do that. They are vegans, they check and they take supplements accordingly.
Okay, that's a better way, I think. Spoken about quite a few symptoms, right? And what is the role of HRT? Everybody talks about it, jokes about it and also, but I have heard that, if you take it also, you need help from the gynecologist. If you don't take it also, you need the gynecologist. So what is the truth about it?
HRT, we have been talking it for more than 3 decades. When I was doing my PG, it came in a very bigger way. And actually, I started my mother with the HRT.
Oh,
she had removed her uterus, and I started with the HRT just after my PG. And she was doing well. She said it's like a miracle for me, and I'm very fit and hale and healthy. And she went to a hill station like Manali. She came back with DVT. That is one of the complication of HRT.
I know, because I've heard many nightmare stories about HRT, and everybody's scared.
So the thing is, that time there were so many complications, and in between it was stopped. Even in US it was stopped. And then again, for the last decade, the HRT is gaining popularity. We talk lots and lots about HRT, but we never used it in our private practice for the past 18 years or something like that. But for the past 2 years, we are now prescribing tablets, gels, and also vaginal creams for selected people, and we have to explain to them, counsel them appropriately, and then we can definitely start them. Because always when we prescribe a medication, we have to see what is the risk versus the advantage for the patient. So if it is advantageous, it is better to start. And HRT is usually started before the age of 60, and it should be started within 10 years of menopause with the lowest dosage and for a minimum amount of period. That definitely gives a good, better any relief for the patient, whether it is vasomotor symptoms or whether they have recurrent urinary infection, vaginal dryness. Even it helps in prevention of osteoporosis, but it is not a treatment for osteoporosis, preventing osteoporosis, and also for mental illnesses like cognitive disorders. Even if it is started before it was set in, then it gives a better relief.
And you're talking about this cognitive disorders, what would you include in them? Of course, I mean, you would refer it more to a psychiatrist or somebody, but then what do they come with? So just to create an awareness, that if this is there, then maybe we should meet a doctor.
No, so brain fog, you call something like brain fog, they'll come and say that they forget everything. They're not able to...
We do it all the time.
Yeah. But that becomes more and more with the advancing age. For certain people, Hema, they have good memory. Those people, they come to us. I don't think people like you and me, we go to the other doctor because we know that we have been having this for quite a long time. But for people who are very, very, who don't forget anything, they come and complain that they're not able to remember anything. They feel fatigued all the time, confusion and irritability. All these things you can say that it comes under cognitive disorders. And also when it is started earlier, because you cannot prescribe to prevent Alzheimer's or for dementia, because it doesn't help for people who already have the problem. But when it is prescribed, they say it improves, it does like preventing these diseases. Probably it is, we have to do many studies, but the studies we have says that it is not to prevent Alzheimer's, or it is not a treatment for Alzheimer's, but it helps a little bit in all these problems in a better way.
That's nice to know. So how long do you recommend to take HRT? I mean, do you think it should be taken for a long time, or it's like, I think it varies from patient to patient, right? So you have to take a decision on depending on what the patient's requirement is and how long you're planning to give it, right?
Yeah, it depends on how the patient reacts to the HRT, because many a times if the patient is doing well, they stop it on their own, but at least recommend them to continue for quite some time. And I ask the patient to come and see you frequently, at least once in 2 to 3 months. And once it is the patient is doing well, we can at least for a minimum period of 5 to 10 years we can give.
Okay.
5 years is the maximum. It depends if the patient is young, and if the patient requires the HRT, we can give it for the maximum of 10 years. And as I said, till the age of 60 we can give.
Okay. And beyond that, you do not recommend?
Yeah, we don't recommend.
That's not going to help.
And when we are giving HRT, we have to investigate the patient for certain things, check for the breast, and do a routine ultrasound to you see for the uterus, endometrial lining, and check her blood sugars, cholesterol levels. All these things should be seen regularly.
And is there a chances of increasing of some kind of a cancer after or during perimenopausal age or after menopause?
Like if the patient is on HRT, if we are giving combined HRT like estrogen and progesterone, because the progesterone is a culprit, if we are going to give it together for a longer period, and the study says that if it is given for more than 5 years, the chance of increasing breast cancer is high. So that should be monitored. And women who already don't have a uterus, we can give them only estrogen, so the risk of breast cancer comes down for those type of patients.
But I mean, earlier there was a lot of debate about this, right? That breast cancer can be caused because of the HRTs.
Not only breast cancer, also uterine cancer.
Yes.
Because for women who have a uterus, it is always better to start them with a progesterone also. Because giving only estrogen will increase the uterine lining. So because of that, they can have sporadic bleed. But even then, there is certain criteria to say that if the patient is on HRT, the uterus lining can be a little bit thicker, and with regular monitoring, we can say that the patient is having, is she going into a problem or not, and accordingly we can stop the treatment. If the patient requires any intervention like endometrial biopsy, we can do that, and then we can proceed if it is normal.
When we hear about these stories about how, you know, like I also keep asking many of my friends, so you went through menopause, how bad was it? And sometimes some people have these stories of saying, oh, that it was bleeding very badly, so I used to never go anywhere, I stopped working because, you know, the bleeding is very erratic and a lot more. So, and then some people have DUB, dysfunctional uterine bleeding, so they have so much of bleeding and very erratically, like dates are not followed and they bleed very often. It's not only during cycles, and during cycles also some people bleed more than normal and have problems with that also. So is there something can be done about it?
Most of the time the people have the strange fact that they think that when they are going to near menopause, they'll bleed like anything, but that is not the fact. Over the age of 40, every woman should undergo screening for uterus, cervix and breast, because the incidence of malignancy increases over the age of 40 for women. And most of the time ovarian cancer and breast cancer, most of the time when we see it is already in stage 3 or stage 4. Because early screening, we will be able to pick up the problems and we will be able to treat them. These patients, when they come to us with the uterine bleeding, abnormal uterine bleeding, if we see that it is something benign, that is, it is not going to cause problem, we'll advise them to be on some hormonal imbalance can cause these problems. So we give them cyclically once in 10 days or something like that. For 3 to 6 cycles we'll give them, and most of the time they get symptom free by the end of 3 to 6 months. But if they have a huge fibroid or if they have some cyst, it should be appropriately treated. Many people think that going to a doctor with abnormal uterine bleeding at the age of menopause, they will advise them to undergo hysterectomy. But that is not the thing. If they go for a proper screening and if we are able to pick up if they have any problems, there are so many options nowadays, because previously we never used to have hormonal treatment or something like Mirena. I think you would have heard Mirena, and those things, they prevent removal of the uterus. So we advise all the women who's in perimenopause and menopause to meet a gynecologist and do an early screening.
That's a nice thing, right? Because they have to be aware about this, because otherwise, even I keep hearing, no, I have a lot of bleeding because of this thing, and until it's absolutely abnormal and they're not able to manage, and they become like, sometimes, they say, I fainted.
Hemoglobin will be 3 to 4.
Yeah, and suddenly, I didn't know what was happening. I was giddy all the time, and then they told me I have low BP, and then they check their hemoglobin levels, and then they come out with this, the outcome.
All that can be prevented with just one routine investigation and an ultrasound. Wow. Because when they have because nowadays we have so many options for preventing the hysterectomy, and these things can be done very early. We have very good medications to shrink the fibroid, and then they can go into natural menopause with the use of Mirena. But if they come with a very low hemoglobin or very huge mass, then there's no option. We have to go for hysterectomy.
You're talking about cervical screening, right? So can you just explain in detail for everybody to understand that how often you should screen? Because I have had patients who do it every year, then there are some people who do it every 2 years, and then now the latest one is, I know, is every 5 years you can do. Yeah. So what is your recommendation for the latest kind of a thing?
Okay, the recommendation is, once the women becomes sexually active, they should go for once in 3 years when they are going to go for a liquid-based cytology. Right. That is like a pap smear. So we do it once in 3 years. Till the age of 30, they can have only that screening enough. Okay. Over the age of 30, they should have along with HPV testing, if they are affordable, because it is slightly expensive. So if they are affordable, they can go for LBC, that is liquid-based cytology, and human papillomavirus screening.
But this human papillomavirus screening, nowadays they have vaccinations also, right? Yeah. And they recommend before 16 years.
Right from 9 years we recommend. Okay. Because from 9 years to 14 years it is 2 doses, okay. 0 and 6. From 15 years to 45, now the recommendation is till the age of 45, the women can have 3 doses of vaccination. Okay. So even if you have your HPV vaccination, the women should undergo this screening. So once in 5 years if it is tested along with the HPV, or once in 3 years if it is only with LBC.
Okay. And this HPV, now why is it so important that the awareness of human papillomavirus vaccination is so high? Because
the government is going for a drive, like we want to prevent cervical cancer. Yes. We want to eradicate cervical cancer, how we eradicated polio and all these things. And giving HPV, it eradicates 95% of the cervical cancer, and along with testing we think that we will be able to eradicate 100%.
Excellent. So there is so now in future we might have cervical free.
Definitely, because nowadays even boys are in abroad, like in in other countries, even boys are given the shots. Yeah, but in India, the government hasn't come out with for boys. But in certain places, the boys and men, they also are taking the shots.
I think they should.
Yeah, it doesn't only prevent cervical cancer, it prevents anal cancer, anal warts and all those things.
We do see such cases of anal warts and many warts because of HPV. So.
Okay.
So during menopause, what are the skin symptoms which, as a gynecologist, they come, when they see a lady doctor, that's the concept, right? They come with all their problems and then they complain about the skin also. So what are the problems you generally see?
See, most of the time they come with dryness. Yeah. We don't see much people with skin changes. They come more to you rather than us.
Yeah, that's a different thing altogether.
But with other symptoms, they will have a dryness, itching in the skin, and also most of them they'll complain of hair loss, all those things. Again, we'll advise them to go for lifestyle changes, stay well hydrated, take lots of protein, and reduce your weight, do all those aerobic exercise. We repeat the same thing day in and day out. But probably I will suggest them some moisturizing cream, that's all. But I don't know whether it is liquid based or all those things. You must be knowing better. If it is, if they have a very disturbing skin problems, we usually recommend them to see a dermatologist.
Nowadays I have seen this, and it is a trend, right? And I've read a lot of literature about it, about how the menopause, like the reproductive age group, has widened. So they start with early menarche, and those women have a late menopause, and a late menarche and they have a early menopause. That's quite strange, right? I mean, would you like to explain that?
No, see, the life expectancy, you must be seeing how it is increased. So the same way, the menopause age also has been increased. For India, it is still 46 to 47 years. But generally worldwide, it is 50 to 52 years. So the increasing in the menopausal age is probably because of the lifestyle changes, how we are taking care of ourselves, and definitely there is something like genetics also, because our mothers, they used to have menopause at the age of 45 to 48, but as the generation goes, as you said, it is 50 to 52, but the thing is that is in a better way. It doesn't, it is not anything anywhere in a wrong sense, because the later the menopause, that is till the age of 55, it is good for the women because the estrogen is still there, and that causes lots of protective effect for them, because the estrogen in the blood, that gives protective effect to the heart, it protects the kidneys, it protects the bones and whatnot.
It gives good skin.
Yeah, definitely. Anti-aging, you look young, and all those things is because of late menopause. But once you cross the age of 55, it should be taken into account why the patient is having prolonged menopausal age, and that should be investigated properly. And if everything is fine, we don't recommend to do any intervention, just screen them and just leave them alone.
How much is the chances of conceiving after the age of 50, like at least during the perimenopausal age? I do agree that, you know, all your cycles won't be to talk it in very layman's term, a viable cycle. But then how often do you see?
So this is a very good question,
conceive?
because I've seen a patient when I was doing PG, she came at the age of 50 years saying that she has some tumor. But we found out that it was 20 weeks pregnant. She already had so much of cardiac problems and renal problems, and it was a nightmare for us to terminate the pregnancy, because the chances of conception is very low after the age of 45. But again, we are stressing the patients to have a contraception if they are not completed the family, but they are not sterilized. For them, we recommend them to continue contraception till they become menopause, that is 1 year after the last menstrual periods. So it is not very uncommon for a woman to become pregnant after the age of 45 to between 50.
So everybody has to be aware of that
Very
also.
aware, yes, yes.